Okay, so I'm going to re-record this video. I have a lot of this in my neuro head, ears, eyes, and throat video, but I'm going to go ahead and make this video that basically condenses pulmonary and cardiac. So I still don't have a real person because my mother is still in Honduras, and by the fact that it's flooded really bad out there still, she's not going to be back until about mid next month. So I'm going to be doing the assessment the best I can on the hippopotamus and explaining the best I can on my hippopotamus. So first off, you want to inspect the patient. You want to see, since we're doing cardiac and respiratory, you want to see how the patient is breathing. You want to check their pulses. If the patient's laying down, before you sit them up to check for all this stuff, what you can do is that you can use your pen light to check for jugular vein distension. You might see it pulsating a little bit, but once they sit up, you should see that pulsation go away and their jugular should flatten. So while they're laying down less than 45 degrees, you may possibly see their jugular vein, and that's completely normal. But once they sit up, if you still see it, that can be a serious issue. So with that said, I don't know if I mentioned already, but while you're also looking at the patient, when you're looking at how they're breathing and everything, you want to make sure they're not using any accessory muscles. You want to check for any cyanosis, their tachypnea, and their rate of retractions, and so on and so forth. So while we have the patient here, since I'm kind of standing above them already, and it's not too far out of the way, I could check each carotid. Carotid on each side for a full minute, and the carotid on each side for each minute. And while I'm here too, I can check their temporal pulses for a full minute as well. Make sure they're equal, and as well as the carotid, make sure it's equal on both sides. You want to make sure you're not doing the carotid at the same time because the patient can pass out. So the first thing you want to do is you want to palpate. You can check the clavicular area. If you feel any crepitus, that can mean that they have lung trauma, and so that's not usually a good sign. When you're palpating, when you're percussing over the lungs and stuff, you want to make sure that it should have resonance everywhere except over the heart and the liver and the bone if you percuss over the bone, but you want to make sure that you don't that you try to avoid doing that. If you should know the general location of the heart. If you're feeling dullness where it shouldn't be, it could mean something is enlarged, or they could have a growth, so on and so forth. So none of those are really a good sign. So you can also when you're palpating for crepitus, okay, I'll let you in. She's going to be crying the whole time if I don't. Come in, baby. Come in. Okay, so you want to be checking for palpating for crepitus. Okay, sorry, my cat's distracting me. Okay, I'm busy. Okay, so you want to first check after you've palpated and have inspected and all that stuff. Actually, and an important thing too, when you're inspecting, they should not have the area from the midline up over here should be half the size of the width of their shoulder area. If it's about equal, that can be a sign of barrel chestness, which is usually not a good thing. While they have their gowns on, if you move it out of the way, you want to shine the pen light over their chest because that would be a good way, because you can see the shadow, a slight shadow or whatever. If they have any growths whatsoever, the pen light can pick up on that, for the difference of light retraction. So once you've done that, we'll go ahead and auscultate. So when you're auscultating, you want to go from left to right on the lung fields. So you want to check the bronchovesicular sounds. Well, well, the up higher is the bronchial sounds. So it's always best to listen for a full minute, and then you get the bronchovesicular sounds, and then you have vesicular sounds as you go down. When the patient is flipped over, you want to do the same from left to right, both anterior and posteriorly. Every time you move your stethoscope, you want to have them take a deep breath for you and move forward from left to right in a lateral motion. And then so while you're facing the backside deck here, you also want to palpate for any abnormalities. You can use your pen light to shine across the skin to make sure there's no abnormalities. You want to check for any lesions, any bumps, any rashes. You also want to, this would be the spinal area right here. So you want to have your thumbs in your palm of your hand like this. You want to have them breathe out and breathe in for you. And your thumbs should retract equally. If they're unequal in them expanding and deflating, then that usually is a bad sign. And then you also want to use your hands to go like this and have the patient say 99, 99, 99 to check resonance. You want to also percuss back here, and it should be hollow all the way down. You want to use your 2 fingers, kind of do it hard, like that. And obviously you don't want to push your patient over. So while we're back here and we listen to everything, another important thing you want to do is you also want to check the right middle lobe. So I'm going to check the right middle lobe, and you should hear the breath sounds equal on both sides. You're going to hear the vesicular sounds. You want to listen for a full minute. Okay. So now that respiratory is good, we're going to go ahead and do and finish off the cardiac that I started a little bit. You want to check brachial pulses, make sure they are equal. Pedal pulses, you want to make sure they are equal. And the pulse behind the knee as well is also an important one. I can't think of the term to save my life right now. It'll come to me after I finish the video, I'm sure. But while we are checking the pulses, from that point, we also check for any noticeable palpitations. If the patients are skinny, sometimes you can see. Hey, y'all stop fighting! You stop fighting. You'll hear. All right, you guys are gonna stop fighting. Okay, so we're gonna check. Hey, stop clawing at the door. They're worse than kids. So I'm going to go ahead now and auscultate the heart. Now, some important thing to look for is when you're listening to the heart. Oh, and speaking of listening, when you're listening to the lung sounds, you want to listen for adventitious sounds. It should be resonant in most areas, when you're percussing. But when you're actually auscultating, if you hear any stridor, any wheezing, so on and so forth, those are non-natural sounds, and you can hear those usually with your naked ears, but your stethoscope makes it better to pick up on that, and you want to keep track of how loud it is, and the frequency, like the frequency of how often it occurs, so on and so forth. Yeah, so that's it for that. Okay, so when it comes to the heart, you want to also start from left to right. There's an acronym that we use called APE to MAN. So APE stands for the aortic, The aortic is the second intercostal space in the right sternal border. Right sternal border? Yes. Yeah, because, right, okay. Yeah, okay, so yes, the right sternal border. So the aortic is the right sternal border. Then you move over to the pulmonic in ape to man, and that will be the left sternal border. Then you move your way down, and then in the third intercostal space, in the left sternal border, right below the pulmonic, is going to be your tricuspid. And then when you move over to the fourth intercostal space in the left sternal border, um, ape. So it's aortic, pulmonic, tricuspid, and then Erb's point, and then your mitral would be heard in the fifth intercostal space in the left midclavicular line. And in that one, you want to listen for a whole minute. And while your stethoscope is there, you want to flip the belt over and listen for any abnormal heart sounds and any bruits whatsoever. And then you want to do that throughout the abdomen as well. You can do that throughout the abdomen to search for any bruits. And since we checked the carotid pulse earlier, you can also use your bell to check for any bruits in the carotid area. And of course, you just want to check one at a time. It'd be difficult to check two at a time with the stethoscope, but nonetheless, you want to make sure you do one at a time and for a full minute, especially if those with the patients who could potentially have AFib, which it's safe to assume everybody has AFib until you assess them. And so we palpated all the pulses. And ape to man. So when you're listening, you want to be listening for all the murmurs. That's what you would use the bell for, as I did. You actually want to. I didn't repeat ape to man with my bell, but you want to repeat it with the bell to check for any extra heart sounds. Oops, my head fell off. Any extra heart sounds and any murmurs while assessing. I would say that's it. We checked all the pulses, checked the heart for any abnormal sounds, checked the lungs for any abnormal sounds, palpated, explained percussion. The S1 and S2 sounds should be heard within equal time, or otherwise would be arrhythmias and so on and so forth. And yeah, we're good. We're good.